Before I proceed, let me explain to you the term herd immunity.
Herd immunity is a situation when a high percentage of the population is protected through vaccination or natural infection against a virus or bacteria, making it difficult for the disease to spread because there are so few susceptible people left to infect. This can effectively stop the spread of disease in the community.
Many of us work hard and complied with the mitigation measures, hoping to achieve herd immunity for COVID-19 so that this disease will stop spreading in our community. But the question is the goal of herd immunity attainable, or is it just a fantasy? As of December 4, 2021, the trend of COVID-19 in the Philippines showed a significant decline, with a 7-day average of 445 cases. As of December 2, 2021, 34% of Filipinos were fully vaccinated with COVID-19. We are still halfway to our target of 70% immunization coverage. Now, the burning question is, did the COVID-19 immunization coverage cause the significant decline of COVID-19 cases in the Philippines? Before we answer that question, let's look at the experience of other countries. As of December 5, 2021, 5 countries, including Philippines, had a fully vaccinated coverage of less than 40%. Despite the low immunization coverage, these countries had low number of COVID cases per million population. There were also countries with fully vaccinated coverage of more than 70%, but their number of COVID cases per million population were significantly higher compared to those countries with low vaccination coverage. There were also countries with more than 60% immunization coverage and had 0 COVID cases. Now, back to our previous question. Did the COVID-19 immunization coverage cause the significant decline of COVID-19 cases in the Philippines? Vaccination may have contributed to the decline in the number of COVID cases, but other factors may also play a critical role. Philippines had experienced surge of COVID cases in the previous months. Data show that majority of the COVID cases have recovered because they either had mild illness or asymptomatic. These individuals have developed natural immunity against COVID. The Philippines is one of few countries that strictly implemented series of community lockdowns and observance of the minimum health standards. Therefore, the factors that may have influenced the significant decline of COVID cases in the Philippines are natural infection, mitigation measures, and, of course, COVID-19 vaccination. These factors may also have contributed to the decline of COVID-19 cases in India and Indonesia, who have experienced surge of COVID-19 cases like the Philippines. We have observed that the incidence of COVID varies from country to country, irrespective of their COVID vaccination coverage. This observation suggests that vaccination alone may not allow us to achieve our goal of COVID-19 herd immunity. The second burning question is the Philippines getting closer to herd immunity for COVID-19? The answer to this question is probably yes, but most likely no. Philippines is closer to herd immunity if we mean elimination or reducing the transmission of COVID. But if our goal is achieving herd immunity to eradicate or completely stop COVID-19 transmission, this goal is slippery. Among human diseases, smallpox is the only example of herd immunity in which the disease has been eradicated from planet Earth through vaccination. Is this possible with COVID-19? Most likely no. Eradicating COVID-19 through herd immunity at this point seems very unlikely ending for the following reasons. First, although the current COVID-19 vaccines are effective at preventing symptomatic disease or death, it is still unclear whether they protect people from becoming infected or from spreading the virus to others. That poses a problem of herd immunity. In order to achieve herd immunity, we need a transmission blocking vaccine. Second is the uneven distribution of vaccines across the world, creating a huge variation in COVID-19 vaccination coverage between countries and even within a country. Even for countries with high vaccination rates, if surrounding countries haven't done the same and populations are able to mix, the potential for new outbreaks remains and herd immunity is difficult to attain. Third, new variants of COVID virus are sprouting up that might be more transmissible and resistant to vaccines. Slow and uneven COVID vaccination coverage in many countries are perfect breeding grounds for new variants to arise that could be resistant to the effects of the original vaccines. Fourth, the protective immunity people generate from vaccination or natural infection doesn't last very long. Antibody levels will taper in the months following vaccination or infection, but that doesn't mean they plummet to zero. This is another phenomenon that hinders the development of herd immunity. Fifth, vaccine hesitancy is a major barrier in achieving herd immunity across the different populations.
Vaccine hesitancy will lead to pockets of unvaccinated individuals in a community. These areas are potential sources of COVID outbreaks. Lastly, people are easing off protective behaviors.
As more people are vaccinated, they tend to discontinue practicing protective behaviors such as mask wearing and social distancing. And that changes the herd immunity equation.
Based on these facts, the goal of eradicating COVID-19 through herd immunity is flimsy and slippery.
We need to stop pushing herd immunity to the public, as it may discourage some people from getting vaccinated in the mistaken belief that if other people get vaccinated, they can just wait for the herd immunity. Local health units should stop talking about herd immunity because it's not helpful for the immediate protection of individuals and the overall response to the pandemic. So, the best thing that we can do at this time is to protect people from severe illness or death due to COVID and preventing healthcare systems from being overwhelmed. This can only be achieved through immunization and risk mitigation approaches. Continued immunizations, especially for people at highest risk because of age, exposure, or health status, will be crucial to limiting the severity of COVID outbreaks, if not their frequency. In addition, we need to vaccinate the people who are most likely to transmit the virus, like young adults, people who have a lot of contacts, and people live with a lot of other people in their households. The current vaccines may not be able to stop completely the transmission of COVID-19, but their protection from severe disease or death due to COVID is good enough at the moment. We don't have to have zero transmission in order to bring back our normal lives. If we can vaccinate almost all the people who are at most at risk of severe outcomes, then COVID would become a milder disease. It may not disappear anytime soon, but its prominence is likely to wane. In conclusion, the focus shouldn't be on herd immunity. It should be on vaccinating as many people as possible. That's what will make the biggest impact on significantly reducing the spread of COVID-19. That's all for today's COVID-19 update. This is Doc Marl at your service. Have a great day ahead.